Hi there, and welcome to the March Allume All Hands Update. Thank you for joining us today. So as you know, this is where we have a brief conversation together about what's happening in the company and bring you all up to date and give you some announcements about things that are happening. So as you see, here we are on our company journey. So we started in 2016. We got our license in 2017. We got our Medicare accreditation in 2017. Launched our services all in 2018. Just finished a stellar year. We had an incredible year together. We provided services to over 25 families in the field, continuous care, plus another 25 that were for skilled medical. And at this point, we're delivering about 6,600 hours per month of services. Our goal by the end of the year is to reach 15,000 hours a month. So we want to more than double what we're doing right now. And we're doing that by basically bringing home 2 patients per month from the hospital. Mostly we bring our patients home from Hospital for Special Care, Connecticut Children's Hospital, and some from Gaylord. We also get referrals from DDS. So we are excited about what's happening. We've got lots of different opportunities for us to bring people in. And the biggest hurdle right now to our growth is finding enough nurses. So we are, as always, hiring. So our goals for this year, and I always like to give you this is our dashboard of our goals. We're growing continuous care by about 700 hours each month. That's our goal. This is a really important focus. It's, on average, we deliver about 350 hours per month per patient. So that's about 2 patients per month. Certainly some of our patients have more hours than that, but on average, that's as many as we deliver. We also are growing our skilled medical practice to 200 visits a month. And right now we're doing about 100 visits a month. So it's really doubling what we're doing between now and the end of the year. Sarah is our new skilled medical marketing liaison, and she's out there really helping us connect with doctors' offices mostly to share the great services that we have with them. The next thing here we have is we're hiring, onboarding, and training 10 to 15 nurses per month, and that helps us get to our 700. We're also offering a $500 signing bonus for right now for our shift nurse role as well as hiring for RN case manager role right now. So please let us know if you know anyone, and definitely be sure to make sure we know that you're the one who referred it, so we can be sure to give you the bonus for this great stuff. We're hiring and bringing on lots of people. We're saying the status on this one is a yellow-green. We got these other 2 yellow just simply because I feel like we need to really keep pushing on that in order to make sure that goal is met every month. So we would like for the average hours per week per caregiver to be at 25 hours, and we've definitely increased that amount. We're at a little over 20 hours a week right now, and so that's a good thing. We want to be able to have continuity of care with our patients, and the other part of it truly is that when we get to work with somebody more hours a week, we really get to know them better, we get to support them better, we feel like we were able to have a better union with the employer-employee relationship. Our next goal is to have 95% of visit notes completed on time, and really what I'm going to actually change this really has to be 100. It's 100% is really the goal. We still have a few repeat offenders, and so if you're one of them, please make it a priority to elevate your commitment to getting your notes in on time. It costs us about $30,000 per week. I know that's crazy, right? $30,000 a week for the few offenders that we have. And we are going to implement a a more rigid policy on this soon. So use this time as sort of a warm-up. We're going to have a 3 strikes, you're out kind of thing because it is so compromising to the team. And it also costs us money. Money that we could use to support our families, money we could use to grow our team, that we can't because we're spending time trying to track down notes. So please make this a priority for you. No more than 1 call out per employee per quarter. That's our goal. Our policy is no more than 3. In order to, beyond that is grounds for termination. But having as few call outs as possible is really, really important to our families. If you are going to be absent, by all means, let us know in advance so that we can find somebody to replace you. And then it's not as destructive or, it's not as problematic for the families. That's the reason why this one is so important. But we're doing pretty well on that. Whenever you can step up, that's great. And sometimes too, if you can't come to the full shift, but you can come to part of it, that's also better than not coming at all. 80% fully scheduled for our new continuous care patients. So right now we're about 75%, which is pretty darn good. We're trying to get to 80. 90% fully scheduled for continuous care patients we've had on service for more than 3 months. We're at about 86% for that. So that's going pretty well too. So in general, our dashboard's looking pretty good. Where we really need to continue to focus is building our hours, making sure that we build new nurses into the mix and make sure that everybody's properly trained and successful. I wanted to update you that we have been very active in our strategic planning. It's the beginning of the year, and that's, I suppose, what happens at the beginning of the year. Our administrative team met for a full day to discuss strategic planning and how we want to grow the business, what we want to focus on, where our priorities should be. And on February 26th, Marie, Stephanie, and we went to a scaling up workshop, which was really fun and very informative. And out of that workshop is this month's book of the month for Allume. Our book club is featuring the book Scaling Up by Vern Harnish, and I'll be having another video on that shortly. But just know that this is all in alignment with what we're doing right now in the office, thinking about how we can really build a strong, solid organization that's growing. Some of our strategic goals, these are our 2 big strategic goals that we're focused on for 2028. So one of the things that when we founded the company, we were really committed to continuous care and making sure that families have access to services, because we know that there's very limited agencies, only about 4, maybe 5 agencies in all of Connecticut out of 180 agencies who actually focus on this. So we are committed to ensuring that every complex continuous care patient in Connecticut who is able to live at home and wants to live at home has a care team and funding system available to live at home safely. So that's something that we are going to continue to advocate for. We are actively partnering actually with other agencies that do this work and working to lobby for better regulations as well as for higher rates of pay so that we are better able to pay our employees. This is something that we're fighting for right now. I was just in Hartford last week, actually, at our legislative day that was sponsored by the Connecticut Association for Healthcare at Home. So this is really important to us, and it's a very big part of our mission and our vision. We also, the other piece is we always have a part of our Remarkable Care vision that includes employees, right? And really, employees are the heart and soul of what we do. Our success is dependent on you all. And so we are committed to our employee first philosophy. And so as such, we really want to find ways to be recognized as the preferred employer of nurses in home health in Connecticut for 8 years in a row. So we will not be focused on that this year as a particular stamp of approval, but we will be working on other ways to get your feedback and to help us build and improve as a brand and as a place that people want to work. So our strategic areas of focus over the next 10 years and certainly right now is a balance, right? We have a need for, support on our patients and making sure that our patients are happy and get what they need. Also growing in terms of patients, bringing on 2 to 3 new patients, continuous care patients a month, bringing in 2 to 3 referrals a week and in the skilled medical. Very important. Lots of energy is spent thinking about how we can onboard and support and serve patients, the curated care plan, the customer journey. All of these are aspects of how we are committed to our patient focus. Nurses are so key. Nurses and home health aides, and as well as other care providers. Nurses are. We think of ourselves as much as a training and employing company as we do as a healthcare company. We think of ourselves equally. We need to be able to train people, to support people, to mentor people. And so we're really focused in all that we do on designing systems that support you and hopefully make you feel supported and engaged, and hopefully that's being felt in your experience. Clinical excellence. So nurses and patients are sort of like, well, of course, clinical excellence, but it's a separate thing. And we have separate parts of our organization that are really focused on making sure we are clinically excellent. Training is part of it, but we also have quality assurance, and we have our record review process. We have our quality improvement process that we're very dedicated to, as well as compliance. Compliance is extremely important. We live in a world where we are regulated by the Department of Public Health in Connecticut, as well as by Medicare nationally. And so in order for us to do good work in the world and fulfill our vision, we have to play by the rules of compliance. And sometimes their rules don't make sense, but we have to follow them, and we have to study them, and we have to make sure we're always completely aligned with them. And last but certainly not least is cash. And it's always the area nobody wants to talk about, but it's very important, right? It's like, imagine trying to care for your family without money in the bank, right? So cash is our tool. It is our well from which we can do all the things we want to do. So we are very dedicated to be good stewards of the investments that we've brought in from our 4 investors, including Frank and I, and then making sure that we can generate ongoing sustainable cash flow that can feed the company ongoing. It's as one of our that's ongoing strength and sustainability, enduring strength and sustainability being one of our core values. This is where it fits. And having all these available is really the key to our success, and making sure we're focused on all parts of this. And the way that we try to do it is we try to identify different members of the leadership team and the administrative team who are dedicated to each area. And you yourself are probably dedicated to one area. If you're out in the field, then clinical excellence is really where you're focused, right? Delivery of care. Patients is your focus, making sure that they're getting what they need. If you're in the office, you might be focused on helping us, bring in nurses, train nurses, or you might be part of the process of making sure that we're able to bill, that we're able to collect, that we're able to be compliant. So thank you all for the contributions that you make every day to make Allume a place that can thrive. And that is all I have for now. So go off and make the world a better place. Talk to you soon.